Hey everybody, this is John. I just want to give a little wrap up to block one. I want to start off by saying everybody did fantastic over the last 2 weeks. I think we had something like 25% or just under 25% the participants in this group are first management course participants. So that first management course is definitely very daunting, trying to figure out all the due dates and rules that go along with how everything's supposed to go. And you guys did fantastic. So there's definitely some room for improvement, which we'll talk about in a little bit. But for the first block, I was impressed. I also want to give a good big old shout out to Anthony and Matt. You guys did great. Helping out with TAs. Again, if you guys have any questions throughout this process, please reach out to either myself, Anthony, or Matt, and we will try to answer as many questions as we can. So, with that being said, your first question that you guys had answered this week was to talk about a red flag situation that you encountered. So I figured I would tell one of mine. So this was roughly this past November is when all this started. So she was a 49-year-old female. She was a previous patient. However, I haven't seen her in about 4 years. Her main complaint was neck pain, but she also said during the subjective exam, I got this little mid-back thing too. If you can look at it when you get a chance, it'd be great. So she downplayed the mid-back. And definitely had neck pain as her worst. Her NPRS at rest was 6. The best was a 5, increasing to an 8. For her cervical spine, thoracic at rest was a 3, which did get down to a 2, but did increase up to a 5. She had symptoms began approximately 4 years ago and have progressively worse over the last 6 months. No specific mechanism of injury. However, she did have lap band surgery 3 years ago and has since lost 174 pounds. She believes that this is the cause of her pain due to the change in her posture. She describes discomfort, aching, superficial, deep burning. Does have numbness into 3 through 5 fingers occasionally, as well as first and second left more so than right, and did have constant non-changing symptoms. It does have a history of C5 through 7 fusion, as well as into 3-4. Most everything kind of increased symptoms into the neck, and medication was her main improvement to alleviate her symptoms. MRI was performed, which did result in bulges, whatever that means. Neurologically, slight decrease but equal reflexes on both sides. No dermatological discrepancies were noted. She did have mild weakness to the right, C7 and 8. Range of motion was limited everywhere, even more so, or more than you'd expect even with a 5 through 7 fusion. And she did have pain with all motions with the exception of flexion. Neck symptoms were present with retraction, combination of protraction with extension, but also present with just straight plain retraction. When screening the thoracic spine, she did not have any mid-thoracic extension, and sideband rotation bilaterally was limited, but no reproduction of symptoms. Weakness with poor scapular stabilizers. She did a positive flexion rotation test for upper cervical, but also a cervical rotation lateral flexion test for first rib. ULTT to ulnar nerve was also present. At that time, I did a trial treatment of mobilizations to the cervical thoracic junction, which improved extension to 35 degrees with the 50% reduction in pain. So overall, pretty happy at that point. So within 4 visits, 3 visits after the initial eval, neck pain improved by 80%. So at that point, we shifted to thoracic spine. Unfortunately, with no change after 3 visits, she was referred back to her PCP for imaging due to the constant low-grade symptoms and not having any inter or intra-session changes. So we kept mobilizing the heck out of that joint. Had her doing a bunch of exercise. Didn't matter if we mobilized, didn't matter if we moved her. Symptoms were still present. So unfortunately, imaging came back after multiple rounds, PET scan, the whole shebang, that we determined she had stage 4 small cell lung cancer, which is terminal. 1-year survival rate at that point, she has been told, is less than 25%. Crazy thing. So normally when we find red flags, we think that we're like Superman, Wonder Woman, or some sort of superhero that we just saved the day. And unfortunately, we're still dealing with humans with feelings and emotions, and those can be good or positive or negative. And she still, with everything, was quite thankful to myself for being able to, or to me to be able to get that imaging performed. She had seen her doctor multiple times, and doctor never scanned her for anything. She does have she's 49 and has an 8th grader, as well as a son who is 21, 22. So she has been able to get her affairs in order. And now she's just setting multiple short-term goals at this point. So she wants to see her daughter go off to high school. She wants to see her daughter go to her first dance. She wants to see her daughter graduate high school, go to college, all these short-term goals that keep increasing in length as she goes. So, not fun. But here's some fun. Shout outs. You guys did great. Some people who stood out more than any for Group Alpha was Josh, Bravo, Matt and Austin. Charlie was Michelle, and Delta was Marcus and Lacey. Good job, guys. Keep it up. All right, so quick review of what we need. Remember, the initial post is due by Saturday at midnight of the first week. Your first response to your colleagues is due by Tuesday at midnight, and the second is due by Thursday at midnight. If you can get those done earlier, that's even take something off your plate, that you can focus more on your original post questions. But remember to promote good discussion and not just compliments or 1 or 2 lines. Your response to your original post is due by Saturday of the second week. Your quiz is also due by Saturday at midnight. I have to put in all the grades on Sunday. So the sooner you guys get all that stuff done, I am able to do that, which is easier for me. Your original post and each initial response post to your colleagues should have an article reference cited in a full text, either a link or a download. So if you provide a link, you shouldn't have to go through 3 or 4 different clicks to be able to get to it. It should be a straight direct link, or you can just download the article onto your post, which is probably a little easier. If you find a reference that is too big, then you can put where you found it at that point. But that's where a lot of guys missed points on this week. It was not providing enough articles that were either cited, not cited, didn't provide the full text, etc. Make sure you use your own words. Don't just copy and paste from the article and or the conclusion. And then remember to, when you're citing, use AMI, which is author, last name, first name, title, journal, date, volume, pages. So topics, medical screening. You guys all had a pretty good grasp of this. Make sure that it's all patients regardless of their method of access, whether it's direct access or referred by an MD. My patient was referred to by an MD, and she ended up getting referred back. So, and it's not just on the initial eval, it's a continuous, constantly, how does this feel? How'd you feel? How'd you do in between sessions? And you're constantly looking for both those red and yellow flags with their response and their answers. Regional independence, hip bone's connected to knee bone, right? Everything's connected to everything. However, think more than just structural biomechanical. Think yellow flag. For sure. Think somatic. Think visceral. And then that case study, consider some of the structures underneath the area of symptoms. So it might not just be the foot, might not just be the calf. And how can this play into your hypothesis? Leave you in suspense. Let you think about that. So coming up, we got the hip. Reminder that there is a video component to posting this week. So you're going to post an exercise treatment for your hamstring into Flipgrid, along with answering some questions, which I'll post later. Resident and MTC virtual rounds, look out for some emails, and reminder to contact me or Anthony or Matt with any questions or concerns. But keep it up. There we go. Everyone's doing great. Find some articles, find some references, and otherwise everyone's doing fantastic. So that's all I got, guys. I will keep checking in on you, and you guys are doing awesome. Good job.